Hey, we're recording here live at the Healthcare Marketing Physician Strategy Summit.
That's correct.
And we're right here in the expo hall, and there's a lot of hubbub around us, a lot of activity, right? This is
a lot going on.
This is a great conference.
Absolutely.
Right?
We're in Vegas.
We're in Vegas. How bad could that be?
Not
and I'm
bad
here
at
with
all.
my good friend Steve from Cast Hue. Steve,
Yes.
welcome to the show.
You know what? It's an honor.
Well, you know, you and I have talked a lot before, but this is the first time we've actually seen each other in person.
That's true. A lot of conversations, a lot of Zoom calls,
Yeah.
a couple podcasts, and then here we are.
Here we are, live,
in Vegas,
together.
live, in front of a microphone.
So what are you thinking about the conference so far?
I am really enjoying it. I mean, there's nothing better. It's like my first conference of the year, and we're getting together with people who are all passionate about the same thing, right? Passionate about making healthcare better, connecting with patients, connecting with healthcare consumers, and able to have those conversations and just, you know, gets you energized.
Exactly. Now, Steve, people may not know you, so tell them a little bit about you and what you do at Cast Hue.
Yes. So, Cast Hue, we're a human-centered design consultancy, and what that means is we put the person first in everything we do. And so from a healthcare perspective, that means understanding that healthcare consumer journey, that patient journey, in a way where we can really dig in deep as to what impacts how people make decisions, how they perceive experiences, and then what moves they make afterwards. Do they stay with their healthcare provider? Do they look for new ones? How is access to care affecting them? And we do that through a lot of qualitative research. We're face-to-face with people. We're either talking to them in in-depth interviews, or we're bringing together them in collaborative workshops.
You know, and I think a resonant theme that we're hearing, like you just said, right, is that a lot of healthcare marketers, communicators that are here at this conference, they're really focused on the fact that they need to understand their customers better in order to deliver better experiences, in order to deliver better digital expressions, whatever it might be. So I think now more than ever, this whole concept of human-centered design is important, right?
Yeah.
You know, and I when I first heard the term human-centered design, I was like, well, of course, isn't all design human-centered design? But that's not really true, right?
One could hope.
Right?
One could hope.
I think we think that that's what it is, but it isn't. It's a science.
Yeah. Well, yeah, and the reality is that a lot of design happens, and we could all think about this without the consumer's input. We, smart people like you and me, get in a room and we design these plans, we think about how this is what it should be, this is what a consumer would want. But the reality is we're making assumptions. Yeah. And that's where human-centered design comes in. It says, let's get that person involved at the beginning. Let's really understand the problem from their perspective, not what we think as the problem is. Because we all have biases. Yeah. If we're part of a marketing team, we know so much that we have biases. We know what's supposed to happen when they go through a digital journey, right? We think it's happening, and we think they're interpreting what we write in that way. But that's not the truth. And we're not going to know that until we talk to them, and not just a survey, but we really talk to them.
Really have that one-on-one, in many cases, that conversation. I think that's the spirit of what we're trying to accomplish here. And I've been through some human-centered design approaches before, and it's a very sobering thing sometimes because you're right, we all have implicit biases about what we're trying to accomplish. I mean, that's why we are experts in the fields that we do, but bringing this in is kind of critical for organizations.
Yeah, absolutely.
And you know, I'm hearing, you know, as we go to, we're now at the end of the first day.
Day one.
A lot of great sessions.
Has it really only been one day?
It feels like more, doesn't it? There's a lot of stuff going on there. There's a lot. And so what are some of the things that you kind of sat in and heard about that really resonated with you today?
I mean, there's been a few. I think there was a great presentation on the future of primary care. And that was really resonating with me because I'm a big fan of value-based care, population health, and that starts with the primary care physician. But we need to understand how we can design experiences that better meet people's needs so that they go to that primary care physician. And I personally, on my soapbox, feel like health systems have the biggest opportunity there, and I don't know if enough are taking advantage. And so Rob Klein and some folks from Renowned Health and some other folks, I should have my script.
Linda McCracken,
thank you. Yeah. You know, the good thing about Chris is that he knows everything, so and everybody. But yeah, with Linda, yeah, they made some great points about here's the opportunity,
Yeah.
but then here's the reality. Like here's what people are thinking about, here's how they're making decisions, and it reflects some of the things that we saw in our research as well. So that was a great one, and I came away inspired, and I hope other people do too, because there's so much opportunity there.
Yeah, and so, and so we have another day and a half, right, left of the conference. What other things are you looking forward to kind of attending? What do you think is going to be resonant, right? What are some of the themes are you seeing?
Well, we all want to know about AI, right? Like you were a fireside chatter. and that was great. It was great to get a practitioner's opinion and get those thoughts and hopefully get everybody thinking. And I think there'll be some more content around that space here. So I'm interested in that. But, more than anything, I'm like thinking about how we're working differently.
Yeah.
How we approach things. There was something in a session that you led today. Not to make it all about you. It should be all about me. Let's make it all about you. But we're talking about like how we're building teams around people, thinking more product focused, meaning let's build around what the consumer needs are, as opposed to that's not in my lane, or stay out of my space, and then kind of that conversation. So I think there's some more content around that. Is like, how do we work differently? Like, how do we create? We're not going to create better things for the consumer, for the healthcare consumer or the patient, unless we're working together, because the patient doesn't see us as departments.
Right.
They see it as one experience.
One experience. And I think that's really, really important to remember, right? And, I know we have a lot of great love for people that work in healthcare, but I think our industry sometimes really struggles with that, right? Because we silo the way we deliver our care.
Yeah.
That's the structure of our organization. Yeah. And bringing things in like tools around user-centered design, things about thinking about like how do we restructure how we do work, that really reflects the current moment where we're at.
Yeah.
Don't you agree?
Absolutely.
Yeah. I mean, we are facing some unprecedented times.
Unprecedented.
I love that term.
I know. But it's true.
I know.
Because everything has changed.
Yeah.
And then everything changed because of COVID. And then that caused behavior change just inherently, right?
Yeah.
But now let's add in the disruptors.
Yeah.
Let's add in the fact that everybody is comfortable with all these digital tools. Even senior citizens, like are jumping on my chart, or jumping on, they want to self-schedule. You know, a lot of them, not all of them, but a lot of them. And these are unprecedented times because the changes are coming from all angles. And that's why we need to really build for what people need right now.
Right. That's so true, so true. Okay, I got my little crystal ball. It's little crystal ball here.
It exists.
But it does exist. So Steve, I'm gonna ask you to look in the crystal ball here. You're getting sleepy. No, I'm just kidding.
Not yet.
As you think about like next year at this conference, what do you think is going to be the resonant theme or the topic that's going to be discussed then? What are we going to be talking about a year from now?
Yeah, that's a really good question. And I said that so I could like really think about what that is. Yeah. Not scripted, folks. Like, it's a good question. I think, next year we're going to be talking about really the evolution of how we could take how patients engage further, patients and healthcare consumers. Mm-hmm. Like we're catching up right now because things are moving so quickly.
Yeah.
And I think we're going to need to continue to take it to the next level. Like, wouldn't we love to see healthcare get to the point where we're breaking down boundaries and not just saying, oh, Amazon did this or Target did this or CVS did this, and so we're gonna here's a way we could replicate it because that's the expectation. But no, let's set new expectations. So I don't know if that's next year, but hopefully we could start looking at that, because that's part of what a conference does, right? Is gives us aspirational things to move towards. And if we could continue this focus on the consumer, the healthcare consumer, we see it everywhere. The other thing I love seeing, speaking of human-centered design, is I see human on so many of these booths and marketing messages. And that's so important because we're thinking about that human. So now let's take that further. Hopefully we'll aspire to that.
Let's actually bring it to practice.
Yeah, let's actually really do it.
Maybe it's not next year, but it's in the near future.
It's in the near future, but we start talking about it next year, right?
I love
think about how long we've been talking about AI.
I love that.
Yeah.
I love that. Steve, thank you so much for sitting down with me and talking,
Thanks for letting me come here.
Absolutely.
I appreciate it.